There we go. Hey, what's up, everybody? It's Kenny Lamons here with Medicare Millennials, of course, where we help train and recruit agents to sell Medicare policies year round and build a large, successful Medicare book of business. This is the second part in a series I'm doing about a very important portion of becoming a Medicare agent, which is which product should we cross-sell? And once we know which type of product we want to cross-sell, specifically what carrier should we go through or which insurance company should we go through to provide that product. And today I have Brandon Reid. He's with Heartland National. We already kind of went through why you should sell HIP plans or hospital indemnity plans. We talked a little bit about why Heartland National, what makes their product specific, but this part 2 video is really going to break down more of the nitty gritty of how you technically sell it and what the benefits of the plan are. So this is great. If you're a brand new agent, this is going to be really good training for you. If you're an existing agent and you don't sell HIP, this is obviously a good video for you. If you do sell HIP, but you don't know anything about Heartland National, you still need to watch this video because it's one of the most popular products like this in the country for a reason. And Brandon will be able to show you a little bit more about why. What's going on today, Brandon?
Hey, Kenny. Thanks for having me on, man. Looking forward to educating everybody on our product and educating everybody on how to actually sell this product in the home or on the phone.
So what do you do? What's your technical role with Heartland?
For those of you who I haven't had the pleasure of meeting, my name is Brandon Reid. I'm VP of Sales with Heartland National. Prior to my role here with the insurance company, I was training agents in the field who sold Medicare Advantage and Medicare supplements.
So you do come from a Medicare background, right?
I do. Yes, sir. Personally, I have sold these plans in the field, and that's why I'm so excited today to share with everybody how I've done it, and so I can help you grow your book of business as well.
Well, let's jump right into it, man. Share your screen. Let's show them about this product. So,
very good. Thanks, Kenny. Again, everybody, my name is Brandon Reid, VP of Sales here with the insurance company Heartland National Life, based out of Blue Springs, Missouri. You've all had the pleasure of meeting Nick Micheletti, our Chief Marketing Officer, on a previous video. Today, I'll be digging into the actual sales side of working this product into your presentation. What I like to do, everybody, is break down traditional Medicare for my clients. And what I've done in the past is positioned Medicare Advantage with the hospital indemnity as an option, but also make sure that the client, your Medicare beneficiary, understands there's other options as well in the marketplace. Medicare supplements or Medicare Advantage with a hospital indemnity. If we're working T65, somebody aging into Medicare, or perhaps somebody coming off Medicare, a retiree who used to have employer coverage, this is a perfect position for us to sell this product. So to start, I like to make sure my clients understand the gaps in traditional Medicare Part A and Part B. I like to let them know that there is a comprehensive option available to them, being your Medicare supplement plan with a standalone Part D drug plan. Although some people may not be able to afford it, this is a comprehensive option, and I like to make sure, step one, all of my clients understand how a Medicare supplement works and what they might have to pay for it. So I like to make sure the client understands that traditional Medicare has holes in it. Part A, leaving you responsible for $1,556 deductible days 1 through 60 in the hospital. Not something to just shrug your shoulders at. A day 61 through 90 daily coinsurance at $389 a day. $778 a day in the hospital during your lifetime reserve days 91 through 150 on traditional Medicare. Guys, we have a way to cover this on a MedSup by paying a premium each month. We also have a way to eliminate the skilled nursing copay days 21 through 100 in skilled nursing. That way, the client's not responsible for that $195 per day, days 21 through 100 in skilled nursing. We have ways to eliminate that 20% coinsurance for Part B. So long as you can afford it, we can package together a Plan N, Plan G, or Plan F that would eliminate all of those copays and coinsurances. Unfortunately, what we're seeing nowadays in the market is Medicare supplements are just becoming simply unaffordable, right, Kenny?
For a lot of folks, for a lot of our folks, it is.
What we're seeing is we're seeing an increase in Part B premiums every year or two, going up last year from $143.50 to $170.10 this year,
Absolutely.
right? First and foremost, we're having to take care of that Part B premium, which some people don't even know is being deducted out of our Social Security check. Then we're having to pay a Medicare supplement premium and a standalone Part D drug plan premium on top of that. And oh, by the way, dental, vision, and hearing is not included in any of that either.
Yep.
And oh, by the way, there's no over-the-counter benefits on Medicare supplement plans. You need transportation, I'm sorry, but you're on your own, right? So why is Medicare Advantage becoming such a popular option in today's market? Well, exactly why Nick stated earlier on our previous YouTube video. Medicare Advantage networks are becoming so much stronger, seeing PPO plans that offer nationwide coverage, the ability to go see a doctor at in-network pricing down in Florida and spend 6 months out of the year there, and come back to Missouri to spend our other 6 months in the summer. Being able to do that at in-network pricing on a PPO plan with a nationwide network is one of the reasons why people are choosing Medicare Advantage with hospital indemnities over the Medicare supplement. Not to say anything bad about Medicare supplements, because we do offer Medicare supplement plans in 10 states. Heartland National offers a Medicare supplement reinsured by Mutual of Omaha that also offers a $300 underwritten bonus. A bonus that pays you, the agent, $300 per underwritten application with no minimum monthly requirements. That's a kick-ass bonus if you ask me.
Hey, real quick, let me stop you right there. So for any agents that are watching this that never work the T65 market and understand that when you present this product, what the examples that he was just giving was when you need to educate somebody who's never been on Medicare yet. Okay. So I don't want to scare away all of you agents that only sell Medicare Advantage. Maybe you focused on like the dual or LIS market only. This product is specifically, the indemnity product is for those customers. But Brandon just did a really good job of explaining that we have to educate people on all of their options if they're turning 65. So I just wanted to clarify that for agents that don't sell med subs for whatever reason, or they don't see a lot of T65s. They're mostly meeting with people that already have a Medicare Advantage and don't want a med sub too. So go right ahead.
Good point, Kenny. And if you don't educate people on all their options when they're first aging in or coming off their employer coverage and retiring, if you don't educate them on both options and 5 years later they come down with end-stage renal disease and need dialysis, they get diagnosed with cancer and need chemotherapy, those are two things where on Medicare Advantage you're paying 20% of the cost for. You're not cost share protected through Medicaid. 20% of the costs. So you tell me, you didn't give somebody their option to get on a Medicare supplement plan when they were in their open enrollment period and didn't have to answer any medical questions, and 5 years later they come down with end-stage renal disease and they're paying 20% of the cost for dialysis treatment, spending $700 or $800 a month on dialysis. You're not going to be feeling too good about yourself at that point.
Yep.
So coming back to the hospital indemnity, our hospital indemnity product is in 36 states, with our med sup being in all the yellow states listed on our screen, in the yellow states above. 10 states on the med sup, 36 on the HIP, with a household discount available in every state. We'll talk about our household discount in just a moment, but just know if you're in Illinois, Ohio, or Oklahoma, keep in mind 2 people do have to apply for the coverage in order to receive a household discount. So when educating the consumer on all their options, we've done a good job explaining the holes in traditional Medicare Part A and B, their ways to fill them, whether it be with a Medicare supplement plan or Medicare Advantage. We see a lot of holes in Medicare Advantage, similar but not exactly the same as we do with traditional Medicare. So what I like to do personally is I like to pull up their summary of benefits. I like to identify some of the exposures on their health plan, and I like to position a hospital indemnity to fill in some of those gaps. So what you see with the hospital indemnity is, for you, the agent, it's not only going to create an opportunity for you to generate more income. When you're waiting on your Medicare Advantage sales to pay mid-January, you're going to have policies paying the same week sometimes on sales you made October 15th. right? November 1st, you'll be paid the same week on your hospital indemnity business. So that helps you be able to afford more leads, be able to pay the bills for some of the marketing you're doing, and pay some of your employees as well if you're working as an agency owner.
Yeah, let me
What it
just
also
let
does,
me just
go ahead.
expand on that real quick. Okay. So cash flow, cash flow, cash flow. It's a lot of the concerns new Medicare agents have, especially during AEP. So just to really clarify that and drive that point home, October 15th rolls around, you've got a great plan, you're out there selling, you're not receiving any commissions till at least January, sometimes February on your Medicare Advantage business. And this product that fits like a glove, which he's going to show in detail, is going to pay you immediately. So this is one of the possible solutions that not only helps protect your customer, but it helps your cash flow during AEP and around in the rest of the year as well. So I just thought that was so important. I wanted to reiterate it again. So
Perfect. And what does it do for your client? It helps protect them from some of those bigger exposures that we talked about on their Part C Medicare Advantage plan. If you're working in the under 65 market, plans with big deductibles, we can position products like this to fill in the gaps. Maybe a lump sum hospital confinement rider that pays your client $2,500 for one day in the hospital. There are ways we can sell this product under 65 as well. It's affordable. It doesn't cost a heck of a lot for you to do it. You can protect yourself from some of those bigger exposures, like in the hospital, trips to the emergency room in an ambulance, your 20% coinsurance for chemotherapy. We can protect you from a lot of that, and it's not going to cost you an arm and a leg to do it. Policy is easy to write. It's simplified issue. If you've written one in the past, it's yes or no questions on the application. We've got a guaranteed issue period between ages 64 and a half to 65 and a half, to where we don't have to answer any medical questions for our base plan and 6 out of our 7 riders. The only questions you may have to answer are related to our cancer benefit, looking back 5 years on cancer. What you'll also see, everybody, and I wanted to make sure I hit on this today, is you'll notice an uptake in persistency. When you start cross-selling a policy like this, you're going to learn real quick that if I'm somebody who has one policy with a member, with a client, I'm probably not, I'm probably not going to have as good of a chance keeping that person my member as if I were to have 2 or 3 policies with them. If they've got one policy with me and they see a commercial from Joe Namath asking them to call into that 1-800 number on TV, chances are they may take that bait if they've only got one policy with you. If they've got 2 policies, 3 policies with you, they're calling you about everything. When they have a question about their Medicare Advantage plan or their hospital indemnity, maybe they take a trip to the emergency room, you're going to be the person they call, helping them get paid a benefit on those services. If you've got the husband and wife on a plan, that helps as well. With Medicare Advantage rapidly growing, you can see the things that we talked about earlier, like networks and added benefits built into these plans, making it a popular option. There's no better time than now to be selling these hospital indemnity plans. So here's how I do it. I like to take a look at the summary of benefits. I like to identify some of the major copays on their plan, hospital copays. I like to make sure that they understand the maximum out-of-pocket and what that means. It's actually a benefit, Mr. and Mrs. Jones, right? But it's also a lot of money, and there is the potential that you could spend a significant amount of money on one of these plans in any given year, right? If you have a bad year. So what I like to do before I get into quoting it is I like to pull up their summary of benefits, whether it's the plan they have now, the plan that you're changing them to, or the plan that you're writing them new to Medicare. I like to make sure they understand how that plan works. If you're on this Humana Gold Plus or United Healthcare PPO, here's what you'll be responsible for May 1st. $10 copay to see your PCP, $45 copay to see a specialist. Nowadays, we're looking at $0 on PCP visits, maybe $25, $35 to see a specialist. Not a lot. Then what I like to do, and you almost laugh at me for doing this, but I like to lead with a negative here. I like to say, Mr. or Mrs. Jones, unfortunately, I cannot protect you from that PCP copay or that $45 specialist copay, but is that something you can afford? And usually they'll nod their head, and they'll tell you, yes, that's something I can afford. So unfortunately, Mr. or Mrs. Jones, I can't do anything to protect you from that small $10 copay to see your PCP or the $45 copay to see your specialist, but is that something you can afford? Yes, it is. What I can do is I can protect you, Mr. or Mrs. Jones, from some of the bigger exposures related to your health plan, like the $340 copay days 1 through 5 in the hospital, like your $188 or $160 copay days 21 through 49 or days 21 through 100 in skilled nursing. I've got ways to protect you from all of that, and it doesn't cost you a lot to do that. You don't want to have to pay $340 per outpatient surgery. You don't want to have to pay that $225 copay in the ambulance down below, or $90 per trip to the ER. I've got ways we can cover that for $30, $35 a month, right? My purpose here, again, and the reason why I educated you on all of your options on that first slide, the reason why why I'm out here is to protect you in the event of an emergency. I want to get you as close to those Medicare supplement benefits that you couldn't afford, but for a fraction of the price. I want to get you as close to those Medicare supplement benefits that you couldn't afford, you told me you couldn't afford, but for a fraction of the price. If paying $170 a month for your Part B, $150 for a Med Sup, another $20 or so for a Part D drug plan, and higher costs on your drugs is not an option for you, right? I want to give you an option. I want to bridge the gap between a $0 premium Medicare Advantage plan and a Medicare supplement. And the way I'm doing that and putting you in the middle is with this product right here. I'm able to supplement your Medicare Advantage plan and fill some of those bigger exposures for roughly $30, $35 a month. You want to take care of things like cancer too, and not have to pay an unexpected 20% coinsurance on the diagnosis of cancer and needing chemo or radiation, then we can protect you with cancer insurance. And here's what it'll cost, right? And I have a very nice way to break down cancer insurance and how to sell that in the home as well, taking their annual benefit, their lump sum benefit amount and dividing it by their annual premium for that cancer benefit. Similar to selling life insurance. You've got a $10,000 cancer benefit added onto one of these plans, these hospital indemnity plans, and it's going to cost you $348 a year for that benefit. It's going to take you more than 26 years, Mr. or Mrs. Jones, to pay into that plan in premiums than you'd receive from a one-time $10,000 benefit. 26 years, right? Not to mention that benefit has a reoccurrence benefit built in to where it'll pay again 5 years later at 100%. Down below here, Kenny, and everybody on today's call, there's a $4,500 maximum out-of-pocket associated with this plan. $4,500, meaning the most you can ever spend, Mr. or Mrs. Jones, is $4,500 on your health costs. That's not including prescriptions. You know one of the leading causes of reaching that maximum out-of-pocket on your health plan? It's the diagnosis of cancer, right? On the diagnosis of cancer, a lot of people end up having to pay more for their prescription drug costs, having to pay more for some of their procedures that are not covered by Medicare, for other drugs administered by physicians that are not covered on Part D, which fall under the 20% coinsurance or Part B coinsurance. Your chemotherapy, all of that starts adding up, and that's a pretty quick way to hit that maximum out of pocket, which is why I like to sell the cancer benefit off of the maximum out of pocket. If you've got a $10,000 maximum out of pocket on a PPO plan out of network, I want to make sure they're protected at $10,000 in the event of cancer. And maybe double that up, maybe set them up with $20,000 cancers so that they're taken care of next year as well for their same treatment that they're probably going through for at least 2 years. Any questions on that, Kenny?
No, man, that's great. That's perfect. The
Okay,
good thing is, hopefully most of these agents, I would hope, have looked at many of these summary of benefits. So you should be able to follow along pretty easy because we're just trying to fill those gaps, right? So cool.
That's all it is, filling in the gaps. So if we look at the scenario on the right-hand side here, somebody takes a trip in the ambulance to the emergency room and they're hospitalized for 5 days.
Mm-hmm.
On this plan, they're left with a $2,015 bill. If you didn't explain that to Mr. or Mrs. Jones, you're going to get a nasty call from the client 6 months to a year later, right? When they end up needing something like that done. Now, rather than getting a nasty call like that, even if you educated them, getting a call saying, oh my goodness, maybe this wasn't the best option for me, maybe I should be paying $100 a month for a supplement. Rather than having things like that happen, go ahead and position a $31 hospital plan to fill in some of those bigger exposures. That way, in the event of a 5-day hospitalization where they took an ambulance to the emergency room, they're actually making $85 in this scenario. They're getting a check for $2,100 to pay a claim at $2,015, right? This is an indemnity policy. It's a cash benefit paid directly to your client. Speaking from personal experience, I've had a gentleman who I took care of over the phone in Houston, Texas, Harris County, Texas. He called me 2 weeks ago. He told me, hey, I remember you told me to call you anytime I ended up in the hospital or, was going to be hit with a big bill on my Part C Medicare Advantage plan. So guess what? I was in the hospital today. He said, well, Larry, I'd be happy to call the hospital with you, but chances are they don't have a bill generated yet for you. But let's go ahead and do that. We called the hospital. I asked to speak with billing. Billing said, yes, we haven't had a chance to generate a bill for you quite yet. So I asked Mr. Larry, I said, Larry, would you call the hospital back a week from now and ask for that bill? As soon as you get it, maybe just email it over to me or email it to customer service. We got it to customer service a week later, and I followed up with customer service. The claim was issued, the benefit was paid, and sent out in the mail that day. I've heard, some of our competitors taking 2 to 3 months to pay a claim. So if you work with us directly, again, Brandon Reid here with Heartland National, just let me know if you need some help with a claim. No reason why your clients shouldn't be getting paid claims quickly.
That's awesome. That's good. Because it doesn't help much with persistency unless it works, right? So hopefully they don't ever even go to the hospital. That's a win-win-win. But if they do, and it takes 8 months to pay out, not a very happy customer. So I'm glad to hear reassurance about that.
Oh yeah, and exactly to your point, hopefully they never need to use it, but they're taking it out in case they ever need it, right? We buy insurance based on when we're going to need it the most, not based on our current health status. So getting into the daily benefits. Daily benefits ranging from $100 a day to $600 a day in the hospital, covering both accident or illness. This is not just an accident plan. This benefit covers both accident and illness. If you've got a $285 copay, days 1 through 5 in the hospital, I'm able to position a benefit at $300 a day, days 1 through 5. Our daily benefit periods ranging from 3 to 10 days, 15, 20, or 31 days in the hospital. A lot of times we see with under 65 agents selling that maximum benefit at $600 a day for 31 days. And typically, usually stacking a lump sum hospital confinement benefit onto that as well at $2,500. That way, in the event of a 31-day hospital stay under 65, that client can receive a check for $21,000. Over 65, for us who work in the Medicare space, we've got the ability to fill in the gaps for their copays on their Part C Medicare Advantage plan. And it's flexible. This plan was designed for this. We've got a daily benefit that pays on observation. If you're in the observation room for a couple hours, we'll pay our daily hospital confinement benefit on observation up to 3 days per year. 100% of our hospital benefit in observation. For the hospital benefit to pay, you have to be hospitalized for a full 24-hour period. For observation to pay, you don't have to be in there for a full 24 hours. On top of that, built into our base plan is a $150 ER benefit that comes at no additional cost that pays 4 times a year. If your client's admitted to the hospital on Part C, Medicare Advantage, typically that copay, $90 or $120, is waived. We still pay our $150 benefit and they make $150 in that scenario. Cool. Maybe they do have to pay their $90 copay. Well, guess what? Mr. or Mrs. Jones makes $60 on that ER visit, right? Helps them pay a couple months of premium.
Perfect.
Down below, you'll see we have a 60-day restoration. Just like with Medicare Advantage, how your copays restore every 60 days, our benefits restore every 60 days. Okay, if you use up your 5-day benefit and 61 days later you're back in the hospital for another 5 days, guess what? We've got you covered. We've got you covered at another 5 days, 300, 350, whatever your daily benefit you selected. Some of the highlights on this plan is our guaranteed issue period that we mentioned earlier, between ages 64.5 to 65.5. The product is issue ages 18 to 85, meaning it is not limited to just the over 65 market. You can write this policy with anything. Even if they don't have coverage, at least they have some protection in the hospital and through some of our riders. Okay. Household discount. We talked about it briefly. All you have to do is live with somebody over the age of 18, or in Illinois, Oklahoma, and Ohio, have 2 people apply for a policy. Policy is unisex rated, meaning males and females pay the same rates. It's issue age rated, meaning you lock in your rate at the time of purchase. That's big, guys and gals. That means if you buy the policy at 65, your rate's locked in at the 65-year-old rate for the rest of your lifetime and time on that policy. Simplified issue, meaning it's yes or no questions on the application. Okay, the only time we look at medical records is at the time of claim. We have a 6-month pre-ex, meaning you will not be paid a benefit on anything related to pre-existing conditions for the first 6 months. Even for our folks getting on through guaranteed issue, be mindful, they won't be paid on pre-existing conditions for the first 6 months. We also have a 2-year contestability that we typically only enforce for 1 year. A 2-year contestability allowing us to look back at medical records to make sure that agents and clients aren't white sheeting applications to get on the plans. So if you file a claim within the first 2 years, we do have the ability to look back and make sure they answered questions on the application correctly. All right? Again, typically only enforced for 1 year unless it's a big claim like a $20,000 cancer benefit. We want to make sure they answered that question truthfully on the application. We do have a dual application available, which is big time. We do have a $25 application fee. However, if you do a dual application, only 1 member is charged the application fee. And Mr. and Mrs. Jones, that's a one-time application fee charged with the initial premium. First month's premium, $99 a month. Next month, $74 a month. Okay, and moving forward. 7 optional riders. Kenny and I were talking about this one earlier. It's a big benefit. If you've got somebody responsible for a 20% coinsurance on chemotherapy, we've got anywhere from $1,000 to $20,000 in cancer to help you, alleviate some of that pressure and some of those costs. So that way on the diagnosis of cancer, you're getting a lump sum check helping you satisfy that maximum out of pocket and that 20% coinsurance. We do pay on in situ, paying at 25% on non-invasive cancer in situ, 5% on skin cancer, and 100% on internal cancers. That benefit does come with a reoccurrence benefit built in. Some companies, again, are adding those on as riders where you have to pay an additional premium for that. The only state where that's not built in is Georgia, where we don't offer the reoccurrence benefit. That benefit builds back to 100% after 5 years cancer-free. Full remission of cancer, and it'll pay again. On top of cancer, we also have a lump sum hospital confinement rider, again used in the under 65 space more so than it is over 65. That pays you a lump sum benefit on one 24-hour period in the hospital. And everybody on today's webinar, this pays twice a year. We have a lump sum outpatient surgery benefit. If you've got a $340 copay for outpatient surgery, you can stack a benefit in there that pays them twice a year per surgery. Skilled nursing. If we end up in a skilled nursing facility past 20 days, we all know on Medicare Advantage plans nowadays, we're subject to $188 a day, days 21 through 100 in skilled nursing. I personally have met clients who have told me horror stories about skilled nursing. Their wife, who spent 30 days in skilled nursing and on day 31 couldn't afford to keep paying that copay, was kicked out of the skilled nursing facility. Thankfully for the husband, he was able to qualify for one of these programs here, the Flex plan, and I was able to stack a $200 skilled nursing rider onto his hospital indemnity plan. That way, if that were ever to happen for him, he's able to position that in there to take care of him. And he'll be paid a $200 benefit per day, days 21 through 100. And actually make money nowadays in skilled nursing. Last three riders here: ambulance, wellness, and DVH. The ambulance benefit costs $2.40 a month for you to add in. Covers both air and ground ambulance. That benefit pays 3 times a year, a total of $600 a year in benefit for roughly $30 a year in premium. Pretty loaded. You'll also see, just like our ER benefit, that's not contingent on hospital admission. You could take a trip to the ER in an ambulance, and that benefit will still pay even if you're not admitted to the hospital. What we also see here, similar to some of your benefits you see with, Humana, the Go 365 program, this is a benefit you actually pay for through our Flex plan at $2.80 a month. Pays $25 per health screening test 4 times a year. So $100 in benefit a year, paying for things like annual physicals, blood sugar testing, colonoscopies, immunizations. Even if you have a $0 copay on a vision or hearing exam, we'll pay you $25 per vision or hearing exam. Because again, there's no coordination of benefits with this plan. There's also no network. You can go see any doctor, you can go see any hospital and be paid a benefit. And that really comes into play when we talk about our dental, vision, hearing rider, available at $1,000 or $1,500 per year. $1,000 benefit option costs about $32 a month. The $1,500 option costs about $50 a month. What we see on this plan is a $100 deductible. However, we didn't want somebody going in for a dental cleaning or vision exam 3 months into their policy and not being covered. So what we've done is we waived that deductible on the below services: $75 in dental cleanings, $50 in vision exams, and $50 in hearing exams after they've had the policy in force for 3 months. Okay? The reason why this benefit is so popular and why it gets sold so much is because there's no coordination. If you've got a plan taking care of all your bills at the dentist's office, and you go send us a bill and show us that you were at the dentist, you'll be paid a certain dollar amount, certain percentage on those services based on our schedule here, which we're about to go over. After having this policy in force for 6 months, we begin paying on those basic services, including a $200 prescription eyewear and hearing aid benefit. That's in addition to your $100, $150 you're getting per year on your Medicare Advantage plan. And again, there's no network. You can go anywhere and use that benefit. We'll pay you $200 as long as you can show us that you got some new glasses or contacts. After 12 months, we start covering those major services, and here's how we pay. We pay off of actual charges, 60% year one. So 6 months in, we need to go get a filling. We'll pay 60% of the cost for those fillings within year one, 70% year two, 80% years 3 and beyond. Again, after you've met that $100 deductible. So Kenny, those are our benefits. That's how I sell the product. If anybody has any questions on this product, reach out to us moving forward, and we'd be happy to help.
Well, look, man, that was great. Stop sharing. Yeah, there we go. Now we're back to normal. That's exactly what agents need right there. So let me put in a little plug here though. Okay. If you do not have this product yet, and you can now see why you should sell it, and thanks to Brandon, how you would sell it. You do not have to do all of your Medicare contracts through Ethan and I just to grab this contract with us. This is a great product. So, if you're already teamed up with us for your Medicare, I encourage you to add this on. If you're just somebody that likes our channel and you wanted to learn a little bit, but you don't have this product yet, please reach out to us. Get contracted with this product now, well ahead of AEP. So you've got it in place, you've practiced selling it, you practice presenting it, and you can get to know people at Heartland National like Brandon that can help answer any of the questions that he didn't go over in the presentation today. With that being said, Brandon, dude, thank you so much for being on. I know you probably do a lot of these since you are the VP of sales, a lot of presentations, but hopefully in the YouTube format, people will be able to catch this 2, 3, 4 months down the road, right before AEP, if they do and they contract with Heartland National to sell this product, what's the best way for them, I guess, to reach out? Is there like an email for agents? Is there a hotline for agents? Like, what's the easiest way for them to, and who should they reach out to for sales support?
Sure, Kenny, and thank you. What I pride myself in is I give everybody my cell phone number, which I know that's a lot, but I'll give everybody my cell phone number right now. And we do have several contacts that can help with agency services, customer service, whatever they need. We've got several emails and phone numbers to reach there. Personally, you can reach out to me at 913-636-8709 or by email at breed@hnlic.com.
Sweet. Brandon, I appreciate you, man.
Okay. Thanks, Kenny.